Let me introduce you to Dr. Sota Omoigui, the doctor behind the first breakthrough treatment for sickle cell in 100 years.
Thank you, Nia. 100 years ago, Han and Gillespie published that hypoxia was the cause of the sickle hemoglobin getting deformed. And in an hypoxic environment, the cells deform, they become rigid, and they get destroyed in the capillaries and the blood vessels. So this obstructs the blood vessels and creates severe pain, which is called a sickle cell crisis, and also organ damage. For 100 years, there's been no way to treat the crisis. There's been no way to stop a crisis that has started. And so the last few years have seen the advent of two medications. The first medication was hydroxyurea, which is an indirect medication. It increases hemoglobin F, the fetal hemoglobin. And what's the purpose of the fetal hemoglobin? Because in the uterus, which is a low oxygen environment, nature evolved hemoglobin F for the hemoglobin cells to retain oxygen better and to survive the uterine environment. So by giving patients hydroxyurea, we are trying to replicate that uterine environment. And by allowing the cells to retain oxygen, they do not sickle as much as they would. So now in the last 2 years, we've had voxelotor called Oxbryta, which is the first medication to directly shift the hemoglobin dissociation curve of the sickle hemoglobin and allow the sickle hemoglobin to retain oxygen in the few milliseconds that the blood traverses the capillaries. And that has also been a game changer. But none of these medications stop a crisis that has started or prevent a crisis completely. So on reviewing the literature, I came to the conclusion that what has been overlooked in 100 years is oxygen. Pure inhalational oxygen. And here we have an oxygen concentrator, a machine that absorbs the air, removes nitrogen, and brings out oxygen. It can be used, or you can use an oxygen cylinder. Now, the situations that lead to a crisis include, number one, at night, sleeping. Because when we sleep, we don't breathe as well. And so sickle cell patients have what you call nocturnal hypoventilation. And that's why 90% of the crises occur at night. Some sickle cell patients are afraid to sleep at night because they never know if they're going to wake up in a crisis and go to the hospital. For the first time, when they sleep with oxygen at night, they will never have a crisis. So we recommend that oxygen is used at bedtime. Doesn't have to be every night, but especially when there are any risk factors like fatigue, daytime exertion, at a high altitude, drinking alcohol. Any of the factors that predispose you to a crisis can be mitigated essentially by sleeping with oxygen. Now, the sickle hemoglobin, within 5 to 10 minutes of forming a gel and trying to form a crisis, is reversible at that point in time. So putting on oxygen within the first 5 to 10 minutes of a crisis, we stop a crisis and prevent the sequelae of the crisis. Severe pain, hospital admission, organ damage, acute chest syndrome, all of that is prevented by oxygen. So we have to go back to the basics, to how this disease was first elucidated by Herrick first in 1910, Han and Gillespie in 1927. If you need more information on the articles I have written, they're on my website, www.medicinehouse.com. So What I'd like to bring now is a patient for whom who I was contacted with by his aunt, a physician, Dr. Emiola Asemota, 3 months ago, telling me that she had a nephew who was not feeling well, having skin ulcers, having multiple crises, multiple hospitalizations, and she had read a little bit of my work, and I told her she needed to get him an oxygen concentrator locally. So subsequent to that, she did that, and he had a dramatic improvement in his health, and he's here to testify and speak about that. But here, this is one of the concentrators. You can use any concentrator. This is the Sickle Eclipse 5. It's portable, has a battery, has a power charger for electricity. It's also certified for flight by the FAA, and it's turned on, and patient needs to just put on the nasal cannula, 1.5 to 2 liters per minute, and that's it. It's as simple as it gets. And now I know we have gene therapy. Gene therapy right now is a cost of $3 million per treatment. And the latest is that it can only treat 100 patients a year. So for patients all over the world, the use of voxelotor and oxygen is as close to gene therapy as you can get. So with this, I will call on my patient, Mr. Seun Kolade, to come over.
So Mr. Kolade, can you please tell me about yourself?
Yeah, good afternoon everyone. I am Seun Kolade. I'm a sickle cell patient, 49 years old now. I got to know about the oxygen concentrator 3 months ago when I had a crisis and leg ulcers on my leg. So not until 3 months ago, I've never had anything about the oxygen treatment in sickle cell anemia. But after the last 3 months, which I've been using the oxygen concentrator and the medication, I've seen tremendous changes in my sickle cell life, which I would like to share with everyone.
Please share.
So until 3 months ago, I visit hospital almost every month in the case of crises, infections and all that, my sickle cell and my leg ulcers. After using the oxygen concentrator, I noticed the first 10 minutes of anytime I want to have crisis and I put on the oxygen concentrator, the crisis just gradually disappear, and which I can sleep better since then. And I've not been visiting hospital regularly the way I used to. And I noticed also that my leg ulcers has been improving in healing. Actually, within the first 2 weeks of using the oxygen concentrator, all the leg ulcers dried up. Actually, it is really reduced, which I was very, very surprised. And I think the use of oxygen concentrator has really helped in the treatment of my sickle cell anemia.
So could you tell us about how you use the oxygen concentrator? Is it easy to use? Does it make noise?
Yes, the oxygen concentrator, well, the first one I have is used with the electricity, which is not it cannot be carried about. So I normally use that anytime I want to sleep or anytime I'm in a relaxed mood in the house. So, and it's not difficult to use. You just have to place the cannula above the head like this. Let me do a little bit of demonstration. Put the cannula and you plug this into the device, and that's it. You are enjoying your oxygen. So it's very easy to use, and it's not noisy at all. It's a device you can sleep with.
So I know prior to using the oxygen concentrator, you were in the hospital almost monthly.
Yes.
How has your experience been post using it for about those 3 months?
Yeah, in the last 3 months after using the oxygen concentrator, I've not visited the hospital at all. I've been managing myself with the oxygen concentrator and the use of this medication, which I have not had any cause to visit the hospital at all in the last 3 months of my using the oxygen concentrator.
Okay, pause. And can you tell us how long you have to use the oxygen concentrator?
Yeah, it doesn't really have a specific time of using the oxygen concentrator. But anytime I feel tired and probably the first few minutes of the crisis, I just put it on, and gradually I sometimes sleep with it, and I wake up in the middle of the night feeling healthy, then I just put it off.
So the symptoms of a sickle cell crisis are severe excruciating pain, a pain that has been classified as 10 times worse than labor pain. There's no other pain that approaches the pain of sickle cell because it's a multi-organ vessel occlusion. And this pain essentially incapacitates the patient and leads to hospitalization for sometimes weeks, and leads to complications like acute chest syndrome that becomes life-threatening. So again, for sickle cell, you have severe excruciating pain, you have jaundice from destruction of the red blood cells, severe joint pains in the legs, in the backs, that are really almost difficult to control with medications. Actually, oral medications don't control it. It has to be parenteral narcotics, parenteral anti-inflammatories, and time is of the essence, because the longer the crisis lasts, the longer the cells become irreversibly sickled after 10 minutes, and the earlier time to intervention with pain medications and anti-inflammatory, the shorter the crisis. In fact, it's advocated that ambulances should have a standing order for pain medication and anti-inflammatories that the patient has previously tolerated in a prior hospitalization, so the ambulances can give the patient the injection of the medication before transporting them to the hospital where there's going to be any further delay. It's no different than patients with heart attack, where the ambulances give morphine when they arrive at the patient's home. So using this oxygen prevents the severe pain, prevents the organ damage, prevents the hospitalizations, prevents all the complications, prevents death. And again, oxygen should be used when the patient is in a high altitude city like Las Vegas or Colorado, when the patient is traveling in the air. No patient with sickle cell anemia should travel in the air without oxygen, because aircraft are pressurized to 8,000 square feet. And at 8,000 square feet, the oxygen saturation for patients with sickle cell is about 77%. So that patient is traveling with severe hypoxia for hours on the end. At the end of the flight, they end up with a sickle cell crisis, a vascular necrosis of the hips, and other severe complications. So the use of oxygen is going to change lives, 9 million lives. Thank you.
Ask the question.
Ask the question. What has been this experience in pain control for its crisis?
So what has been your experience in pain control for your crisis?
Well, the pain could be as excruciating as Doctor has explained it. Sometimes when the crisis starts like that, you can't do any other thing other than shouting and crying. At times you cannot even lay down, you can't stand up. You can imagine how bad the pain could be. Sometimes in months you cannot even walk, because the pain will be so excruciating that you cannot even lift your leg until you try and get a pain medication. Even after using the pain medication, it's not going to work until the next 30-40 minutes. So you can imagine through all that minutes, going through a very excruciating pain, and see how difficult and alarming that could be. So, but then with the use of this oxygen concentrator now, I notice each time I'm feeling sick, dizzy, or probably tired, and I started feeling the pain. The first 10 minutes of the crisis, I put on the oxygen, and I noticed that's happened to me like more than 3 or 4 times now. I noticed the pain gradually disappearing away.
Oh, thank you.
Okay, in conclusion, I'll give you our case reports from the LA Pain Clinic, Hawthorne, California. We've had so far about five to seven patients, and on the average they used to have crisis once every 2 to 3 months, and hospitalizations once every 3 to 5 months. With the use of the oxygen, their crises have turned to once every 6 months, and their hospitalizations have turned to one every 3 to 5 years. Generally, the hospitalizations occur when they're out of the house, when they're exposed to cold, when they have infection. But as long as they're in the house and they have access to the oxygen, they have no crisis and no hospitalizations. Thank you.
Good.
That I've gotta make a change. I don't care if I break, at least I'll be feeling something. Just okay, it's not enough. Help me fight through the nothingness of life. I don't wanna go through the